Huh?
Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience who are joining us from different parts of the world to yet another episode of Imamia Medic's International Women's Wing Health Awareness Series. Today's episode of the Health Awareness and Health and Wellness series is being brought to you by the Connecticut and New York chapters. And we have a very important topic to discuss with you all to spread more awareness and a wonderful panel of panelists. The topic we will be discussing today about, inshallah, would be mental health awareness. And I will begin today's episode with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Translation. In the name of Allah, the Merciful, the Compassionate. Say, He is Allah, the One and Unique. Allah, who is in need of none and of whom all are in need. He neither begot any, nor was he begotten, and none is comparable to him. Sadaqallahul Aliyyul Azim. Once again, I welcome all our wonderful audience who have been joining us in our previous episodes and have joined us today as well. And I would like to introduce our moderator for today's program without any delay. We have with us the wonderful, the amazing, and very important member of our Women's Wing community, Dr. Nazneen Zaidi, as moderator with us today. Dr. Nazneen Zaidi did her medical degree from Liaquat University of Medical Sciences, and then she did her residency from Bakai Medical University in OBGYN. She got an MCPS degree in OBGYN from College of Surgeons and Physicians, Pakistan, and did her diploma in sonology from JPMC. She has worked in Aga Khan University Hospital and has been working as a consultant and director of Thalassemia Prevention Program, prenatal diagnosis at Fatmeed Hematological Medical Center, Karachi, Pakistan. Currently, she is working on the sustainability of the Thalassemia Prevention Project. We are honored to have you with us, Dr. Nazneen. You're most welcome and thank you for joining us.
Thank you, Varda, for the kind introduction. Bismillah Rahman Rahim and Assalamu alaikum, everyone. As you all know, that today's webinar is on mental health, and mental health is the foundation of our overall well-being. So in this session, we will be discussing two important topics related to mental health. Today we will learn about postpartum depression, यानी बच्चे की पैदाइश के बाद जो ख़वातीन डिप्रेशन में मुब्तला हो जाती हैं या उनमें डिप्रेशन की अलामात ज़ाहिर हो जाती हैं, हम उनके बारे में बात करेंगे. और we'll also learn about childhood depression. It is very important for us to know that children can also suffer from depression. So today's webinar is going to be a very informative, inshallah. So without further delay, I would like to begin our program with the introduction of our experts. We are honored to have with us Dr. Tasbih Fatima and Dr. Mehreen Raza, who will be sharing their valuable insights and expertise. So I would like to introduce our first speaker, Dr. Tasbih Fatima. She got her medical degree from Sindh Medical College. Dr. Tasbih completed her residency from Mayo Clinic, Minnesota. She has more than 20 years of professional experience. Dr. Tasbih is a board-certified adult psychiatrist. She is an expert in training depression, bipolar disorder, psychotic disorders, post-traumatic stress disorder, anxiety disorders, and late-life depression-related problems. She is currently served as a director of Partial Hospital Program, Department of Psychiatry, North Central Bronx Hospital, and she is the assistant professor of Albert Einstein School of Medicine. Assalamu alaikum, Dr. Tasbih.
Walaikum salam, and thank you for the introduction. Assalamu alaikum, all the audience who has joined and listening to this presentation. सो आज हम बात करेंगे बेसिकली पोस्टपार्टम डिप्रेशन। पोस्टपार्टम डिप्रेशन बेसिकली डिप्रेशन होता है जो कि बच्चे की विलादत के बाद या चाइल्ड बर्थ के बाद वुमेन में होता है, और बेसिकली सिर्फ वुमेन में नहीं, मेन में भी हो सकता है। सो बेसिकली डिप्रेशन जो है वो यूँ समझें कि पोस्टपार्टम डिप्रेशन जो है वो अफेक्ट करता है इन एवरी 1 in 7 न्यू मदर्स में हो सकता है। और जो है वो एवरी टाइम जब प्रेगनेंसी होती है तो 30% मोर चांस इंक्रीज हो सकते हैं पोस्टपार्टम डिप्रेशन के। नाउ बहुत कॉमनली होता है कि विच वी कॉल इट पोस्टपार्टम ब्लूज या बेबी ब्लूज के जब बच्चे की विलादत के बाद न्यू मॉम्स जो हैं वो ओवरवेल्म फील करती हैं, और क्राइंग स्पेल हो सकता है, एंजाइटी हो सकती है, जो कि 2 से 3 दिन के बाद शुरू होते हैं, एंड इट कैन लास्ट अप टू 2 weeks, एंड इट्स वेरी कॉमन कंडीशन। 60 to 75% एक्सपीरियंस करती हैं मॉम्स। बट जब सिचुएशन ज़्यादा सीरियस हो, जबकि मॉम जो है वो न्यू मदर्स या जो भी मदर जिन्होंने चाइल्ड बर्थ से गुजरी हो, सो उनमें सिवियर फॉर्म ऑफ डिप्रेशन भी होता है, जो कि लास्ट मोर देन 2 weeks, बेसिकली मोर देन 4 weeks और इवन अप टू 6 months भी हो सकता है। और वो समटाइम्स दिस डिप्रेशन जो है वो इतना सिवियर हो जाता है कि पोस्टपार्टम साइकोसिस में भी बदल सकता है, एंड वी विल टॉक अबाउट पोस्टपार्टम साइकोसिस लेटर ऑन। और सिर्फ मॉम्स में डिप्रेशन नहीं होता, बल्कि जो पैटर्नल डिप्रेशन भी कहलाता है, जो फादर्स में होता है। 8 to 10% ऑफ द फादर ऑल्सो सफर फ्रॉम depression after the birth of a child. And usually they don't talk about it, or and similar psychosocial issues होते हैं उनके भी, basically, which we will discuss later. So क्या symptoms हो सकते हैं depression के after childbirth? Basically, सबसे पहले तो depressed mood हो सकता है, mood swings हो सकते हैं, difficulty bonding with the baby होती है उसमें, loss of appetite, sleep issues, tiredness, lack of energy, चिड़चिड़ाहट हो सकती है, angry हो सकती है माँ, anxious, panic attacks हो सकती हैं, घबराहट होती है इसको, isolation, माँ जो है वो बच्चे की केयर नहीं कर पाएगी, और withdrawal from family and friends, ज़्यादा घुले मिलेंगी नहीं, fear होता है कि भाई they are not a good mother, और कभी कभी उन्हें suicidal thoughts भी होती हैं। Sometimes they are crying too much, and lack of activities, interest, reduced ability to think, सोच नहीं पाती, तवज्जो नहीं दे पा रही हैं, रेस्टलेस हो रही हैं। तो दीज आर द साइंस होते हैं। चिड़चिड़ाहट भी हो सकती है, जरूरी नहीं कि माँ ये कहे कि भाई मैं डिप्रेस हूँ। So what is basically the postpartum psychosis, right? जो सिवियर फॉर्म होती है डिप्रेशन की, उसमें साइकोसिस होता है। साइकोसिस जो है बेसिकली टर्म हम यूज करते हैं जब कोई वॉइसेस या आवाज़ें सुने जो कि अराउंड ना हो, या कोई चीज़ देखें जो कि वहाँ नहीं मौजूद है, या कोई ऐसी बिलीफ हो जो कि रियलिटी पे बेस ना करे। अक्सर माएँ जो हैं वो, उनको ऐसा लगे कि बच्चा रो रहा है लेकिन वहाँ कोई नहीं होगा, या मुख्तलिफ किस्म की आवाज़ें सुन सकती हैं। यूजुअली इट्स वेरी डिप्रेसिंग वॉइसेस होती हैं। या फिर ये कि कभी उन्हें डिल्यूजन्स हो सकते हैं, पैरानोइड हो सकती हैं कि भाई कोई हार्म करने आ रहा है, या कोई बच्चे को नुकसान पहुंचा दे, इस टाइप से। यूजुअली 1 to 2 per 1,000 women में होता है आफ्टर चाइल्ड बर्थ, सो इट्स अ रेयरिटी बट इट्स एन इमरजेंसी। सो बेसिकली अगर माँ में साइकोसिस हो कि वो आवाज़ें सुनने लग जाएं, या फिर थॉट्स होने लग जाएं कि भाई वो अपने आप को हर्ट करना चाह रही हैं या बेबी को हर्ट करना चाह रही हैं, वेदर deliberately or accidentally, it is real, so it's an emergency. So फौरन जो है अस्पताल ले जाना चाहिए, 911 कॉल करनी चाहिए और इमीडिएट उसको अटेंशन ज़रूरी होती है। अ, अब कैसे रिकग्नाइज कर सकते हैं पोस्टमार्टम डिप्रेशन को? बेसिकली इसके स्क्रीनिंग्स होते हैं, डिफरेंट टूल्स डॉक्टर्स यूज़ करते हैं, PHQ-9 है, डिप्रेशन स्क्रीन टूल होता है पोस्टमार्टम डिप्रेशन, इसके एडनब्रा पोस्टनेटल डिप्रेशन स्केल, सो डिफरेंट स्केल्स हैं जो कि बेसिकली हेल्प करते हैं टू आइडेंटिफाई, और अर्ली डिटेक्शन का फ़ायदा ये होता है कि अर्ली ट्रीटमेंट और बेटर आउटकम होता है। सो ये कब टूल्स यूज हो सकते हैं या कौन सा बेहतर टाइम होता है कि आप जो है उसको स्क्रीन करें? सो पोस्टमार्टम विजिट्स बहुत अच्छा टाइम होता है, जब चेकअप के लिए आप जा रहे हैं, बच्चे की पैदाइश के बाद बच्चे का चेकअप है या माँ का चेकअप है, उस वक्त डॉक्टर्स एटलीस्ट US में तो PHQ-9 करते हैं। दूसरा ये कि प्रीनेटल विजिट्स भी अच्छा टाइम होता है कि जब चेकअप किया जाए। सम प्लेसेस पे ये चीज़ें ऑलरेडी पुट इन प्लेस हैं कि वो ये डिफरेंट स्केल्स करते हैं, सम पे नहीं, लेकिन बेसिकली अगर हस्बैंड जा रहा है साथ में या घर वाले जा रहे हैं तो इस चीज़ का ख्याल रख सकते हैं, दे कैन आस्क डॉक्टर फॉर अ स्क्रीनिंग एज वेल। What are contributing factors of postpartum depression? कि क्या चीज़ें जो हैं वो हाई रिस्क कर सकती हैं postpartum depression? So basically having a पहले से अगर किसी के डिप्रेशन है या ये कि उनको जैसे हिस्ट्री ऑफ डिप्रेशन है या प्री मेस्ट्रुअल डिस्फोरिक डिसऑर्डर है या पोस्टमार्टम डिप्रेशन की फैमिली में हिस्ट्री है, सो दे आर एट इंक्रीज रिस्क। फिर लिमिटेड सोशल और पार्टनर सपोर्ट जो होता है वो कर सकती है। दूसरा ये कि मैरिटल और रिलेशनशिप कॉन्फ्लिक्ट्स, या माँ जो है वो एम्बिवेलेंट हो प्रेगनेंसी के मुतालिक, या बेबी जो है वो स्पेशल नीड हो, या ये कि हेल्थ इश्यूज हैं बेबी के साथ, प्रीमेच्योर बर्थ है, सिंगल मॉम्स, यंग मॉम्स, in some cultures gender of the baby is important, कि मेल है या फीमेल है। दूसरा है कि domestic violence is also one of the issue, exposure to violence, unemployment, low socioeconomic जिनमें होता है उनके भी chances ज़्यादा हो जाते हैं। अब ये कि how to treat and manage the postpartum depression, उसके बहुत सारे different avenues हैं, right? जाहिर बात है फैमिली सपोर्ट एंड स्पाउसल सपोर्ट ज़रूरी होती है ड्यूरिंग प्रेगनेंसी एंड आफ्टर चाइल्ड बर्थ, बट समटाइम्स यू डू नीड बेसिकली प्रोफेशनल हेल्प, क्योंकि डिप्रेशन के लॉन्ग टर्म नेगेटिव इफेक्ट्स होते हैं बोथ ऑन मदर एंड चाइल्ड, सो अर्ली intervention and treatment are very important, right? The best approach, basically it's individualized care होती है, whether उस वक्त जो है वो सिर्फ थेरेपी चाहिए या मेडिकेशन चाहिए या बोथ चाहिए, right? In cases of severe postpartum depression, including those with suicidal or homicidal ideation or psychosis, mental health profession की reference ज़रूरी होता है कि आप refer करें उन्हें। So treatment of postpartum depression में basically आप clinically treat कर सकते हैं patient को with medications, but different forms of therapy भी use कर सकते हैं, जैसे interpersonal therapy है, cognitive behavioral therapy है, supportive therapy है। Basically interpersonal therapy में ये कि जो आसपास के जो relationship issues हैं, how they can manage, work through it, जो कि क्रिएट कर रहे होते हैं स्ट्रेस इन लाइफ एंड दे मूव ऑन विद दैट। कॉग्निटिव थेरेपी ये है कि डिप्रेशन में पर्सन के अपने जो हैं वो कॉग्निटिव मीन्स कि जहनी नेगेटिविटी होती है आपकी जब आप डिप्रेस होते हैं, तो हाउ यू कैन जो है वो उस थॉट्स को किस तरह आप चैनलाइज करें इन ए पॉजिटिव वे ताकि आपका बिहेवियर बेटर हो जाए। तो वो कहलाती है कॉग्निटिव बिहेवियर थेरेपी। दूसरा फार्माकोलॉजिकल ऑप्शंस में ये है कि SSRIs हैं, मोस्ट ऑफ द लोगों को पता है कि भाई प्रोजैक है, पैक्सिल है, या सर्ट्रलिन या जोलॉफ्ट हैं, bupropion, and these are the medications which are not only safe for the pregnancy but also for after pregnancy. अगर माँ जो है वो breast feed करा रही है तो they are relatively safer medication और वो उनको दिया जा सकता है। और बहुत सारी अगर बहुत ही अनट्रीटेबल और बहुत सिवियर डिप्रेशन हो तो इलेक्ट्रोकन्वल्सिव थेरेपी कराती है, ECT, वो भी दी जाती है विद स्पेशली विद द साइकोसिस। अगर साइकोसिस है जिसमें हालुसिनेशंस हो रही हैं, डिलूजन्स हो रहे हैं, तो डेफिनेटली नीड ट्रीटमेंट। बहुत सारी दफ़ा इन पेशेंट ट्रीटमेंट चाहिए होता है कि भाई हॉस्पिटल में दाखिल भी कराना पड़ता है, और मेडिकेशंस जो कि एंटी डिप्रेसेंट्स सॉरी एंटी साइकोटिक्स होती हैं, देयर हेल्डोल या रिस्पिडोन, ये भी दी जाती हैं जस्ट टू मेक श्योर दैट कि सिचुएशन रिजॉल्व हो जाए, क्योंकि इट कैन बी लाइफ थ्रेटनिंग। So is postpartum depression is preventable? So it's not entirely preventable, but it helps to know that there are some warning signs of the condition and what factors can increase. So let's say. So basically, be realistic about the expectation of yourself and for the baby, right? अगर आप अपनी रियलिस्टिक रहेंगे अपने एनवायरनमेंट के मुतालिक, आपके कैसा सपोर्ट सिस्टम है, हाउ यू कैन डू इट, हाउ मच यू कैन नॉट डू इट, सो और ये कि सो दैट्स हेल्प बेसिकली। अब जैसे लिमिट विजिटर्स, इफ यू आर बाय योरसेल्फ या आपके पास इतना हेल्प नहीं है, सो यू कैन मॉडिफाई एनवायरनमेंट बाय लिमिटिंग विजिटर्स। और जब आप वापस जा रहे हैं, सब मिलने आना चाह रहे होते हैं कि भाई बेबी से मिलें, तो यू कैन मॉडिफाई सम ऑफ द थिंग्स कि भाई लोगों से आप कोई पर्टिकुलर टाइम दे सकते हैं, इस तरह कर सकते हैं। Ask for help. Let's other know how they can help you. Okay. Sleep or rest when your baby sleeps. Exercise, take walks, get out of the house for a break. Keep in touch with your family and friends. Don't isolate yourself. Foster your relationship with your partner. Make time for each other. Expect some good days and bad days. हर चीज perfect नहीं होती. So ideal situation may not achieve, but close to get a better days is by having a more harmonious relationship, अपने basically environment के साथ चलें, और when baby sleep, you sleep, that's also decrease the so sleeplessness, which is one of the अपनी diet का ख्याल रखें, ये सारी चीजें important होती हैं। So basically that's pretty much about the postpartum depression and psychosis. So hopefully it will be helpful to learn a little bit about it.
Thank you so much, Dr. Tasbih. That was very informative and concise presentation.
Okay.
Thanks a lot.
Sure, you're welcome.
So it's my pleasure to introduce our second speaker, Dr. Mehreen Raza. She got her medical degree from Dow Medical College. And Dr. Raza completed her residency from University of Medicine and Dentistry of New Jersey Medical School, Rutgers University. She completed her fellowship in child psychiatry from Rutgers University. She is an expert in treating anxiety disorder, attention deficit hyperactivity disorders, depression, obsessive compulsive disorders, autism, conduct disorders, eating disorders, and psychotic disorders. Currently, she is serving as a director of child and adolescent inpatient psychiatric unit at Mount Sinai Hospital, affiliated with Trinity Health of New England, and she is assistant professor at University of Connecticut. Now I would like to invite Dr. Mehreed to talk about childhood depression. Assalamu alaikum.
Walaikum assalam, and thank you, Dr. Nazneen, for your kind introduction. Assalamu alaikum to all the audience. Today, I'm honored to talk about childhood depression, which is very important topic to understand because हम ऐसा सोचते हैं कि बच्चे तो depressed हो ही नहीं सकते. Or actually in our culture also, we also think that बच्चे तो बच्चे हैं, उन पे तो कोई चीज़ इस तरह का हम उनके बारे में ख्याल ही नहीं करते हैं. But actually, childhood depression is a mental health disorder where child also can be persistently and severely sad, often along with the diminished interest in activity they once enjoyed. This childhood depression can be characterized by a range of symptoms that include um, their eating habits, their sleeping habits, their energy levels, concentration, and self-esteem. Is actually you can you this defines childhood depression, but you can see changes in their behaviors, and that's how you have, as a parent, as a caregiver, you have to be mindful of that. That child can be depressed, and they can show these type of symptoms and the changes in their behaviors. So now the prevalence of childhood depression. We are talking about mostly United States kind of statistics. And so when we see a 2016 study, it was found out that 5% of the 12 years old and 17% of the 17 years old reported major depressive episode in the past year. But when we see this national survey of children's health data, it showed that in 2016, where 33 to 17 years old, their depression increased from 3% to 4% in 2020. So they showed that as we are like as the years passing by, we actually we had seen the 30% increase in depression in children as compared to like 2016 to 2020. So there's a big change, and that actually prevalence increased multifold after our uh, past COVID-19 pandemic, where actually this prevalence in depression increased multifold from that point. There's a high surge in depression and anxiety in children during pandemic. And why that happened? Because of social isolation, loneliness, lack of physical activity, familial stress, and that all contributed to the worsening and prevalence of depression. So, in simple words, we can say that 1 in 5 children and adolescents globally suffered from depression. Meaning, एक बच्चा 5 बच्चों में से एक बच्चा डिप्रेशन का शिकार है. So that's a very high number if you look at it. And if you compare between mild to severe depression, so we see that severe depression is common in 21%, moderate to severe at 18%, and major depression at 3.7%. So, so we, as a child psychiatrist, I see, and it is known that there are certain hallmarks. Like if you see younger children, you'll see that irritability is the hallmark. जो बच्चे जो हैं 11-12 साल से छोटी उम्र के होते हैं, जो जिनकी उम्र सिर्फ खेलने कूदने की है, अगर वो बच्चा आपको persistently cranky मिल रहा है, यानी चिड़चिड़ापन है उसके अंदर, और वो जो है हर चीज़ में नखरे कर रहा है, खा नहीं रहा, रोए जा रहा है, और ये एक क्योंकि नॉर्मल बच्चे को डिप्रेस्ड बच्चे से डिफरेंशिएट करने का पॉइंट है, तो उसमें आपको ये देखना है कि परसिस्टेंटली उसमें ये प्रॉब्लम चल रही है, तो वो इसका हॉलमार्क है. अंडर 10 to 12 ईयर के बच्चों के अंदर अगर डिप्रेशन है, तो अगर आपको बार बार उसका गुस्सा, उसका चिड़चिड़ापन, उसके खाने पीने में चेंजेस और रोना धोना बहुत ज्यादा कॉन्स्टेंटली चल रहा है, देन दैट शोज दैट दिस किड माइट बी डिप्रेस्ड. then adolescent depression, which is a little change in as compared to एक छोटा बच्चा बिल्कुल और एक adolescent वाला बच्चा जिसको हम teenage years में का बच्चा कहते हैं, उसके अंदर और उसमें और एक adult depression में similar symptoms होते हैं. So that kid, you will see that a bit, they may have a bit more pronounced sadness, social withdrawal, and changes in eating and sleeping patterns. So you'll see that that child who's adolescent, who's a teenage above 12, you'll see that more with more pronounced sadness. That is also known as melancholic depression. And you'll see that kid is more isolating from the family, not hanging out with friends or the family. They are mostly staying in their room, mostly like शक्ल उतरी हुई लग रही है, थके हुए, physical activity में interest नहीं. Or especially एक point that if the kid was used to engage in physical activity, playing outside, or happy, lively, you will see the change that that kid is now not interacting much, not talking more, and staying in their room, or their eating pattern has been changing, meaning less eating, or they are not sleeping at night. Now we also see that there's a lot of engagement with social media, which is also sometimes a depressed kid is spending much more time on the social media. So these Instagram and Snapchat, those are also sometimes we see that these are the main factors of the depression. So what are the causes and risk factors? So in depression in children, you see that causes and the risk factors are kind of intermingled. You see that there can be genetic factor that include family history, and if they have depression and anxiety or other major disorder like bipolar or schizophrenia in the family. So that very clearly shows that. There is another cultural factor that maybe their depression and anxiety was not addressed, but you know that somebody was had some changed behaviors in their lifetime. Family can tell you. The other thing is brain chemistry. So what is that changes in brain, in our brains and the kid's brain, that actually causes depression? So we have three very important neurotransmitters जो रतूबतें ब्रेन के अंदर होती हैं: सेरोटोनिन, norepinephrine, and dopamine. These three neurotransmitters they play a very important role keeping us in a good mood. So imagine that these are our brains have a kind of a quantity of those hormones in balance. So that balance can be impaired, or they can be imbalanced by their genetic factor. Maybe their genes are programmed in the way that they have low serotonin for some reason, or they have differences in dopamine or norepinephrine. But what other factor is that life events. So that's another risk factor, that if a bad life event, what can be a bad life event is like any kind of abuse or trauma or losses in their lives. So what happens that when they have those kind of incidents and life events in their life, they can actually alter the quantities of these neurotransmitters. So if somebody is going through hardships, if some kid had a very bad childhood, like abused or witnessed domestic violence or war or violence, so imagine those all the kids in Gaza, and they are seeing and witnessing such a hard life of war and all that, they exhaust. So our brain get exhausted, like with all that from neurotransmitters, so they get low in the brain. So that's why our medication help in the way that they go inside and they make our cells to produce those neurotransmitters. The other thing is personality trait, which is also, I would say, that a risk factor. So who can get depressed? The kid with poor self-esteem, the kid with have pessimism, like they only see low, and they have bullying going on in a school. So those are the kind of personality trait that can be a raw material for developing depression. So another unfortunate thing, that chronic illnesses are also risk factor for development of depression that include diabetes in children, cancers, and other chronic illnesses like heart conditions. So those are the risk causes and risk factors. Some another important point here, very more scientific, but I will try to explain it in a layman language, is BDNF, brain derived neurotrophic factor. So brain derived neurotrophic factor is a protein in our brain that actually fluctuate from early childhood to the late ages. So our this BDNF is actually present in a child, and it fluctuates depending on how we are developing. So if the kid is going through harsh life and abuse and traumatic life, their BDNF can go low, and that becomes a problem where adolescents brain can develop depression, because that's a neurotrophic factor, that's a kind of a food for the developing brain. And so adolescent can get hit by decrease in that level. And the two brain areas that are in this picture, you can see that prefrontal cortex and also hippocampus, those are the two areas for that can regulate our emotions. So this is this BDNF is a factor, is a food for those brain areas. And in adolescent brain is still developing, so if the level goes low because of harsh environment, it can affect and develop depression. So later on, BDNF naturally go low. So late life depression, when you if you check, BDNF is naturally low. So now those kids who are at risk, the people who has talked about suicide. So how come the kids can talk? Because if the depression gets they go untreated or unaddressed, these kids will follow and eventually start thinking about suicide. So the people who have previously talked about suicide, previously attempt to hurt themselves, is struggling with depression, having negative feelings, having emotional distress, or people who experience war, violence, trauma, abuse, or discrimination, and people who are socially isolated, they are all the ones who are at risk of suicide. So, suicide, of course, is a very important topic, and is the second leading cause of death in young people between age of 10 and 19. And it is very important to screen for suicidal thinking, because untreated and unaddressed depression in youth can also lead to have suicidal thinking. So, what are the red flags? If you see a kid who is in despair, who so schools have very I mean, kind of an interesting way of checking the kids, because if they see kids researching the ways to die, or they are withdrawing from people, absences from school, or they are and they talk to somebody about considering taking their life. So these are the feelings that are included in National Institute of NIH. They describe these are the signs and red flags to screen them for suicide. So schools have way of seeing that the kids, what kids are researching on the computers. And likewise, we as a professional, as parents, you have to have open communication with children to see if what they are thinking, what they are into. So changes in behaviors, if the kid is looking in despair or in distress, it's very important in our duty to find out what's going on. So now we have few crisis lines that are available, and everybody have to have those numbers handy. And schools should have that also, so that they can talk about that, and kids should have that, so that if they are ready to, sometimes, kids feel like they have no help and they are not able to talk to their parents. So at least awareness is so important that they should know about these hotlines, so that they can get some help if it is needed. um, so I have seen that, fortunately, they when they start thinking, it's not the time when they attempt, fortunately. But unfortunately, many of them attempt also. So having that, so if they think about getting some help, they can at least call. So this is 1988 suicide lifeline, crisis lifeline. They can text on 988. They can chat at 98lifeline.org, and they can also text on 741 to text hello to that number. There is another, so maternal depression also affect on childhood development. So how maternal depression, what does that do when mothers are depressed, and especially the pregnant mothers? So when pregnant mothers are depressed, what happens that stress actually causes our brain areas to develop to produce cortisol. So what happens that when the cortisol is produced, this cortisol actually cross placenta and they go into the baby. So what happens that what this cortisol can do in an unborn child, it can cause obstetric complication, it can cause brain alteration, behavioral problems in the kids, and reduction in their cognitive and emotional functioning. So this kid is kind of now, while the baby is inside the mother's body, is programmed to have more behavioral problem. Why? Because this cortisol is going in and causing all these changes in the unborn child. And when the same child is born, they can have behavioral dysfunction, they can have some cognitive impairment, they are more prone to develop ADHD, they are more prone to develop emotional dysregulation, also metabolic dysfunctions, and brain alterations. Yeah, so treatment of childhood depression. Before that, same as Dr. Tasbi discussed, we also have PHQ-9 and their children depression inventory. These are the depression scales that we screen kids with and diagnose them with depression. The timeline is if the kid, at least the kid, if the kid is depressed for 2 weeks, that is the timeline, because we have to differentiate a normal child also. Sometimes normally the kid can be upset for some reason, but we have in DSM-5, it's a manual of all the disorders. We have 2 weeks of depressed mood. So what can we do? So as a parent, if you what you can do if you think your child is depressed is that spend more time with your child, and it's your duty to protect your child from stress, for maltreatment, and from violence. So if you know that your child is going through bullying, you have to talk to a school counselor and set up a meeting with the school to see that what's going on there. If you see that child is going through some big issue, like there a lot of times is these days is the social media. So have some insight about that also, that what child is doing, what they're watching. So have some parental control on the social media of the child. Also, if you see that the child is depressed or irritable for a long time, you need to get some professional help. And also make sure as a parent that they are taking enough sleep, they are properly eating, they are engaged in physical activity. And also, you as a parent, you should know that what your child enjoy, what you do as a family, what this child is having fun with. So if you see that the kid is not doing what they used to do, so that this is the sign to see what's going on. And also that if you see the joy is they're losing their joy in things, eating or their physical activity or other things, and their academics are also declining, it's just time to get some professional help.
Thank
Okay,
you,
thank you.
Dr. Mehri. Thanks a lot for sharing your valuable knowledge with us. Thanks a lot. So let's begin our question and answer segment of this session. So we have a few questions from our audience. So we have a first question with Dr. Tasbi because it's related to postpartum depression. So, Dr. Tasbi, the question is, what is the difference between postpartum depression and postpartum psychosis?
So, Assalamu alaikum दोबारा से भाई. So, postpartum depression is basically जब कोई भी माँ जो है वो sad feel करे, right? Sad हो, restless हो, anxious हो, sleep नहीं हो रही हो, पूरी insomnia, और जो है वो इंटरेस्ट नहीं ले रही हो बेबी की केयर में, अपनी केयर में, या कीप अप एनवायरनमेंट के साथ ना कर रही हो, तो वो डिप्रेशन होता है. और डिप्रेशन की जो डेफिनेशन है बेसिकली उसका ये कि भाई 2 वीक्स और मोर फंक्शनिंग इम्पेयरमेंट हो, राइट? तो वो डिप्रेशन कहलाता है, मेजर डिप्रेशन. सो पोस्टमार्टम से फ़र्क ये है कि आम डिप्रेशन से पोस्टमार्टम में, कि पोस्टमार्टम चाइल्ड बर्थ के बाद शुरू होता है. और साइकोसिस में ये फ़र्क है कि साइकोसिस में जब वही माँ जिसको डिप्रेशन हो रहा था, या कभी कभी सडनली भी स्ट्रेस की वजह से वो स्टार्टेड हियरिंग वॉइसेस, कि भाई उन्हें ऐसा लगेगा या तो वो खुद से बातें कर रही होंगी या कोई ऐसी आवाज़ें आ रही हों जो कि रंग ना हो. समटाइम्स दीज आवाज़ें जो होती हैं या हलुसिनेशंस होते हैं, कभी विजुअल हलुसिनेशंस भी होते हैं, जैसे डॉक्टर महरीन ने जो है वो बताया कि भाई उनकी एक पेशेंट जो है वो माँ देख रही थी कि भाई देवर नागन या सांप थे, बच्चे नहीं थे वो. तो दीज आर विजुअल हेलुसिनेशंस, राइट? और कभी पैरानोया होता है कि भाई जो आसपास के लोग हैं वो खिलाफ हैं माँ के, या बच्चा जो है वो समथिंग गोइंग रॉन्ग विद द किड, राइट? कि जो बच्चा पैदा हो उसके साथ कोई चीज़ वो है, प्रॉब्लम हो रही है, जबकि नहीं है. तो ये सारे साइकोसिस होते हैं. कभी कभी आवाज़ें ये भी कहती हैं कि भाई अपने आप को मार लो या बच्चे को मार दो, या हार्मफुल थॉट्स होती हैं. तो ये जो होती हैं ये साइकोसिस होता है. जबकि डिप्रेशन में खुद से भी, बिकॉज ऑफ द डिप्रेशन, सुसाइडलिटी हो सकती है, कि भाई इंसान सोचता है कि मैं अपने आप को मार लूँ, मैं इसको बर्दाश्त नहीं कर पा रहे, या जो भी है. लेकिन जो साइकोसिस होता है उसके अंदर हलुसिनेशन, डिल्यूजन्स, ये सारी चीज़ें आ जाती हैं. डिल्यूजन इज फॉल्स बिलीफ बेसिकली, तो उसमें पैरानोया आ जाता है. तो यही फ़र्क है दोनों में बेसिकली. लेकिन दोनों जो हैं, अगर डिप्रेशन सुसाइडलिटी की हद तक चला जाए या साइकोसिस डेवलप हो जाए तो इमरजेंसी होती है.
Dr. Tasbih से ही related एक question है, as you mentioned earlier, कि postpartum depression और postpartum psychosis दोनों ही डिलीवरी के बाद के मसले हैं. लेकिन इन दोनों में से कौन से क्लिनिकल इमरजेंसी हम कहेंगे और कौन सा लाइफ थ्रेटनिंग होगा?
Okay. So basically, लाइफ थ्रेटनिंग जो है वो क्या कहते हैं, सुसाइडलिटी हो या होमिसाइडलिटी, कि भाई आपके थॉट्स आने शुरू हो गए कि बच्चे को मार दूं मैं, या खुद अपने आप को मार दूं, जो कि डिप्रेशन में होता है, वो क्लिनिकल इमरजेंसी होती है, राइट? और लाइफ थ्रेटनिंग भी है. इसी तरह जब आवाज़ें कोई माँ सुन रही हो हलुसिनेशन में, और तो वो इमरजेंसी है, राइट? और उसमें आवाज़ें ये भी कहती हैं कभी कभी कि भाई अपने आप को मार लो या दूसरे को मार दो, या पैरानोइड होने लगती हैं कि कोई हार्म करने वाला है या खुद हार्मफुल हो जाए इंसान. तो ये सारी चीज़ें ही लाइफ थ्रेटनिंग होती हैं और इमरजेंसी सिचुएशन होती है, और इट नीड्स इमीडिएट अटेंशन बेसिकली.
Thank you for the comprehensive answer, Dr. Tasbih. Now another questions for Dr. Mehreen. Dr. Mehreen, how common is depression among children, and are there some alarming sign कि जिससे parents को ये मालूम चल जाए कि their child is developing depression?
Okay, yes. So this is very important. So as I simplified, usme 1 in 5 in a younger or adolescent, 1 in 5 has depression, is going through. So that how much common it is. And the alarming signs, there are some different. So don't think that if the child is crank, yes, first of all, you have to rule out any medical complaints. So if the child is cranky, they can have they are they may be having a stomach ache or something. Younger child, यंगर ही चाइल्ड हो और उसका जो बिहेवियर हो वो चेंज हो रहा हो और सारा टाइम वो क्रैंकी हो, इरिटेबल हो और रो रहा हो और जो भी मतलब ये कि चल रहा हो काफ़ी, तो यंगर चाइल्ड में दीज आर द साइंस वेयर and any medical thing has been ruled out. So at that time you'll think that there is something wrong, and you this
All right.
can be depressed. And they can have the other factors like maybe uske environment बहुत harsh हो, maybe domestic violence उसकी surrounding में हो, वो उस surrounding में हो जहाँ पे violence और war zone का बच्चा, मतलब कोई बच्चा कोई भी हो सकता है, लेकिन अगर बच्चे के अंदर constantly irritability और crankiness or behavioral problems, physical complaints. Actually, these kids are also they complain more about stomach ache to avoid going to school. So if those are the signs that a kid can be depressed. In adolescent, the signs are more like in teenagers, the signs are more like social withdrawal. वो अब सबसे वो ज्यादा बात नहीं कर रहा बच्चा, जो पहले इतना सोशल बटरफ्लाई था अब वो बिल्कुल खामोश हो गया है, कमरे में ज्यादा रहने लगा है। और आजकल हमें ये भी देखना है सोशल मीडिया पे बहुत ज्यादा, सोशल मीडिया का भी काफी रोल है कि उसके अंदर बहुत ज्यादा बच्चों की, स्पेशली लड़कियों की सेल्फ एस्टीम को नीचा करने में इसका बहुत बड़ा रोल है. So these are the signs for in childhood depression that parents should be mindful of and look out for these.
All right. क्या डॉक्टर मेहरीन, पेरेंट्स जो एक बच्चा डिप्रेस है, क्या पेरेंट्स उसकी घर में किस तरह से सपोर्ट उसे दे सकते हैं?
I mean, आपका सबसे बेसिक सपोर्ट ही पेरेंट्स से स्टार्ट होता है. यानी कि पेरेंट्स ही हैं जो आपको सबसे पहले, इवन आपने देख लिया हाउ मदर्स डिप्रेशन कैन अफेक्ट द चाइल्ड. सो मदर को खुश रखना बहुत इंपॉर्टेंट है. तो उसके बाद बच्चे को खुश रखना बहुत इंपॉर्टेंट है. सो बच्चा कैसे खुश रह सकता है? बच्चा को सबसे पहले जो उसको सपोर्ट मिलती है वो मदर्स और एनी केयर गिवर्स अटेंशन टू देयर नीड्स. सो बच्चा को आपने फीड करना है और उनकी हर नीड पर उनको उनकी वी हैव टू मीट देयर नीड्स, मीनिंग वो गीला वो नहीं हो, उनके डायपर चेंज हो और उनको खाना मिले और उनको कडलिंग मिले. दैट इज योर immediate role after you deliver baby. So baby's depression can develop from the infancy age if mother is neglectful. Mother can be neglectful in many ways. So here we see a lot of drug using mothers. But हमारे culture में fortunately ये सब नहीं है. But there are other factors. Mother can be depressed, and as Dr. Tesbi Fatma said, that mother is not caring for the child because she is suffering from depression, and maybe she's thinking about the child has something or child is something else. So वहां पे ये हो गया. Then as a young child you have to provide the safe environment. That's your duty to provide. If your environment has violence, if your environment has something you can control, some things are not in your control. So the ones you can control, it's your duty to provide them. What kind of environment? Safe environment where nurturing is going on, where you are talking to your kid. You know how the kid, even when they don't they are not even speaking well, but mothers are understanding their language.
Yes, definitely. Yeah.
So attend to them from the young. Then older ages, you should know where your kid is going. Is there anything going on at school where kids are picking up on your child, they're teasing or bullying your child? So those are your. Then you, as a parent, you have to have open communication from the beginning. You have to set this, that you are talking with your child every day, like when they come back from school, asking about their day, how is it going. And so kids, kids will talk to you if you keep the open communication. So that is very important. Looking after them, seeing that they are sleeping properly, eating properly, not like on the social media all night long. So all those things are so important for the well-being of the child. So those are the signs, and that's how you're gonna you can pick up on things before it gets too late.
Can depression affect a child's school performance?
Yes, because in depression, the very important symptom is poor concentration and poor memory. So if the kid is depressed, they are feeling tired, they are not concentrating well, and they have forgetfulness also. Sometimes they look like they have attention deficit disorder, but once you treat depression, they get better. They are no more ADHD. So in kids, you think that this kid cannot be depressed. Maybe they have poor concentration only. But actually, a depressed kid can have poor concentration and decline in school performance. And in kids with depression, they also they complain about they talk about physical complaints, and they try to avoid school also. So be mindful of that. If a kid is just complaining about stomach ache or headache just in the morning, and after that the kid is fine, so you have to also see that what's going on, why this kid is trying to avoid school. So
Thank you for the brief description, Dr.
you're
Mehdi.
welcome. You're welcome.
Now, other question is for Dr. Taspi. What preventive measures can be taken to help new mothers to avoid postpartum depression?
Okay, yeah, thanks for the question. So basically, measures, ये हैं कि as we talked earlier कि भाई realistic expectation, अब अगर किसी के पहले से एक और बेबी है, फर्ज करें couple of year old है, या तो उसका कि भाई how to manage both the kids, right? ये कि आप अपने अगर you don't have your mom around or mother-in-law, then आप अपने friends से arrange कर लें, या if you can able to afford, आप पहले से sitters वगैरह किसी इंतजाम करना चाहिए, ताकि आपके ऊपर overwhelmed feeling ना हो कि अब मैं क्या करूं. The same thing is that कि आप अपने environment को जो है वो किस तरह prevent कर सकते हैं इस तरह के, अगर आपको even during pregnancy if you started feeling कि भाई मुझे थोड़ा सा मैं थोड़ा सा sad हो रही हूँ, तो address that ahead of time. आप ड्यूरिंग प्रीनेटल केयर आप अपने डिप्रेशन को एड्रेस कर सकते हैं. इसी तरह जो है वो सिमिलरली फाइनेंस सारी चीज़ें का आप पहले से अच्छी तरह प्लान कर लें, ऑर्गेनाइज कर लें, तो एक्चुअली इट डिक्रीज योर फीलिंग ऑफ ओवरवेलमिंग कि भाई अब मैं क्या करूँ एट द लास्ट मिनट. सो दैट्स हेल्प्स कि आप अपने आप के एनवायरनमेंट को किस तरह जो है वो ऑर्गेनाइज करके रख सकते हैं, विच हेल्प्स यू टू प्लान बेटर, और आपके बेटर आफ्टर चाइल्ड पर आप उसको मैनेज बेटर कर सकते हैं. सो यही मोस्टली जो है इश्यूज होते हैं. अदर देन दैट अगर आपको आई थिंक इट्स the other question about the stressful, right?
Yeah.
Yeah.
Other question is regarding to postpartum psychosis. वो ये है कि क्या साइंस हेल्थ केयर प्रोवाइडर्स देखे कि इस पेशेंट को पोस्ट पार्टम साइकोसिस की तरफ जा रहा है, तो किस तरह से उसे एड्रेस करना चाहिए?
So basically, अगर अर्ली इंटरवेंशन जो होती है डिप्रेशन की, बेसिकली वो प्रिवेंट कर सकती है साइकोसिस, राइट? साइकोसिस इंटेंस. दूसरा एक ज़ाहिर बात है, अगर पोस्टमार्टम डिप्रेशन हो रहा है, या अगर हिस्ट्री भी है, अगर फर्ज करें सब किसी में बाइपोलर की हिस्ट्री है, या प्रीमेंस्ट्रुअल सिंड्रोम जो होता है उसकी हिस्ट्री है, या डिप्रेशन की ऑलरेडी हिस्ट्री है, so they are going to have an increased risk for postpartum psychosis as well. So उसके अंदर यही है कि आप early detection, early treatment basically. दूसरा है कि अदर साइंस जो है, अगर खुद से नहीं वो कह पा रहे, तो वो बार बार अगर चेक कर रहा है बच्चे को जाके कि बच्चा रो रहा है और वहाँ कुछ भी नहीं है, या ये कि पैरानोइड हो रहा है, आसपास वाले देख रहे हैं कि भाई ये जो है वो खामखा में ये सोच रही है कि कोई साजिश कर रहा है मेरे खिलाफ, या समथिंग लाइक दैट, तो दैट्स आल्सो वन ऑफ द वार्निंग साइंस हैं. या वो खुद से बातें कर रही है, कोई माँ अपने आप से टॉकिंग टू हर सेल्फ, ऐसा लग रहा है कि कोई नहीं है, बट शी इज एक्चुअली टॉकिंग इन एयर. So that's also one of the signs होते हैं कि भाई so these are the some of the factors, or yeah, poor care of herself or the kid also actually one of the early signs कि भाई ये कुछ सही नहीं हो रहा. So, yeah.
Thank you. That was very informative, Dr. Tasbih.
Yeah.
Now, the next question is for Dr. Mehreen. How does maternal depression affect a child, and can it impact mothers and child bonding?
Yes. So, as I talked in my presentation before, that maternal depression affect child at different levels. If the when the mother is pregnant, when the mother is pregnant with the child and she is going through stress, so that mother, and even obesity in mothers, so obesity and depression in mothers or stressful mother who's pregnant can release cortisol. Cortisol is our stress hormone that we all release when we are stressed. So that cortisol crosses the placenta and go to the baby. So that actually causes changes in the brain of the baby. That cortisol can change the baby's brain, and that brain, when the baby is born, baby is more at risk of developing depression. So that's one level where this baby is already at risk of developing depression. The other is mother may not be depressed in during pregnancy. The baby was developed fine in the womb, and that baby is delivered. Now the baby is born, but now mother is depressed. So when if the mother is depressed, like postpartum depression, mother has postpartum, now this mother is not attending to the child's need. So now this baby is uh, is neglected,
Hmm.
and this baby who is neglected, who is wet for hours in the diapers, or is not being fed properly, and mother is not cuddling, or mother is not breastfeeding the child, so that baby is at a different level, is at risk of developing depression, because this kid is neglected. So that's another level. So if the mother is depressed, mother will not cuddle child that much. There is another thing in child psychiatry, we say that not any more love is not enough. Like a love you can give to your child, like infinite level.
Yes,
There is no
unlimited.
end to love that you can give to your child.
Yeah.
So the love mother gives has a big role in bonding. um, yeah, so that mother, we'll say that mothers who they can have problem with breastfeeding, they can, but the same mother can bring the bottle feed but is still feeding the child. So I'm just
Yes.
trying to explain that it's not like mothers who cannot breastfeed, who cannot, like mother is sick some other way, but the bonding actually happens when you are mm, meeting child at three levels. One is feeding them, other is like cleaning them, keeping them dry, and also giving them emotional support. Like if the kid is actually left alone crying, and they kind of stops crying by themselves, this kid develops reactive attachment disorder. It's a very bad condition. There is no, like this kid takes that reactive attachment disorder to their lives, like full, they have that condition, and they will not become, there's a problem in their such a deep down that they cannot develop good relationships, because they never learned our bonding thing we learned at with our mothers. So the bonding is, if you have problem with the bonding, that problem will go on to all the levels in your life. So so maternal depression is a big factor where child can be affected, and child can be depressed. Other caregivers also play a big role in that. If other caregivers are also, like in our joint families, other dadis, nanis, pupos, khala can, so that's also a big help. That's why we are fortunate to have these supportive network where if the mother is little bit depressed, also the other people also come forward, so that child can be prevented.
Yeah. Thank you. And we have received one another question from our audience. What could be the role of friends in helping a teenager with depression?
Teenager with depression, so similar, same thing, like as a like a big role of parent to talk about their day-to-day life with their children. um, and if they are depressed, and just see that what social medias they're using, and uh, maybe directly going to that when you didn't do that from the beginning. It's a little bit go slow, and take care of that slowly. But if you're starting, if you want to get some advice on um, how to deal with that, is that don't let your kid to be on social media without monitoring. So, and there's some limit some screen time. So adolescent depression, adolescent actually they show their depression in different ways, like social withdrawal, isolation, more sadness. um, and if there is that, you have treatments available. You have medications and therapy. Actually, therapy and medication, they can both work together for quick recovery. So there are medications that are approved in children, and they have better side effects profile. They are safe in children, and you can get quick response. Therapies also has a big role in, because they can talk about their feelings. And sometime with poor self-esteem, the kids thinking style changes, so restructuring of the mind that can occur with therapy. So medication and therapy both can work the best and has a best outcome.
Thank you for the brief answer, Dr. Mehreen.
Yep.
Now it's another question for Dr. Tasvi from our audience. What could be the role of husband in helping a mother who is experiencing motherhood to reduce chances of postpartum depression?
Yeah, so basically, um, it has a very important, the husbands have a very important role, right? Um, I mean, they are as much as the parent as the mother. So if they can help, fixing the feet, taking care of their turns at night, so that mom can sleep, or taking paternal leave to take care of the baby, that's a support, and it will help to flourish not only the bonding between the child and the father also, but also it's a very good support for the mother as well. Um, and then be reasonable, right? Not putting very high expectation or demand on the mother that, oh, okay, now here's the kid, but take care of me as well, kind of a thing. So creating an environment which is, again, it's not just for the child, the nurturing environment is the adult needs the nurturing environment as well. And so that's the support mom needed from the spouse, basically. Then also, we live in an environment, especially in our community, where there's a sometimes combined family system, and there's a lot of things interplay, interpersonal relationship with other in-laws. And so these are the things which, if keeping a more healthier boundary between all the relationships also helps, basically. As well as, there are the places where there's a domestic violence, and emotional abuse and things like that can happen through the hands of a spouse. So I think getting a more professional intervention sometimes needed as well. But basically, just remember, baby is for both, not just the mom. So if
Right.
creating a healthier environment will be better for everybody, basically.
Thank you, Dr. Tasvi.
Mhm.
Now, my another question is for Dr. Mehreen. It's really a very important question. कि अगर एक डिप्रेस बच्चा है और वो अनट्रीटेड है, कोई ट्रीटमेंट उसे नहीं मिली, ना डायग्नोसिस हुई है really, ना ट्रीटमेंट हुई है, and what could they turn to harmful habits to cope with?
Yes, so untreated and unaddressed depression can lead to suicidal thinking also. That's a like worst thing to happen. That they can have poor school performance. They can decline in that. The worst thing, which everything is bad, like nothing is good coming out of untreated depression. But the other thing, which we think that it cannot happen to our children, children from our community, is the drug use. So unfortunately, drugs are there and they are easily accessible. Good areas, bad areas, they are available everywhere and anywhere. So if the kid is, because they are talking to their peers, and not everyone is coming from same household. If the kid is friend with somebody and somebody introduced them to some of the drug and they feel like, oh my god, this thing that I just took away all my worries and all my anxiety, all my depression, they will get stick to that, and they will, it's easily accessible, so they can get addicted to their. There are some drugs that are prevalent in high schools, like marijuana, Xanax, pain pills, alcohol, like. So there is that drawback that if you leave your kid unattended and their depression go untreated, other than what I talked about, like suicidal thinking, poor academic performance, decline in their school performance, they can also get hooked up with drugs. So then you have a whole other problem in hand.
Yes. As you mentioned that treatment of depression is very important, right, in childhood or children also. So what are the treatment options for depression in children then?
So treatment options are medications and therapy. We have different sets of medications. You know how I described that our neurotransmitters go low, like in the brain, our neurotransmitter go low, and the neurotransmitter imbalances occur, and that leads to depression. So we have medication that promotes and development of those neurotransmitters. um, there are some medications, ssris, snri. There are different names, there are variety of medications available. There are few that are fda approved, drug monitoring, um, federal drug monitoring association, that's approved by them, and they that we use safely in children. Yes, we have to be a little careful about what to choose in younger children, what to choose in adolescents. So there is that, plus therapy. Like there are interpersonal therapy, which is actually how the kid is dealing with the peers and family, like people to people, interpersonal therapy. And the other thing is the inner perspective of the child, how this child is thinking. Like some children who are thinking about, they have low self-esteem, they only can think about low and negative about themselves. So in those therapy, the one therapy is how you're dealing with people in your life, and the other one, which is cognitive behavioral therapy, it's actually how you are thinking. So these therapies restructure your thinking style. So medication actually provides brain with some healthy neurotransmitters, and therapy actually using those techniques to rewire your brain. So those two together can help your child to have a better mental well-being.
Thank you very much. It was very informative. Now, the last question for Dr. Tasbih. Can stressful surrounding cause depression? यानी अगर stressful surrounding है एक खातून के लिए, तो उसे अगर वो depression का बाइस बन सकती है, तो how should that be treated?
Yeah. So, I mean, depend on the level of stress, right? So, अगर तो उस हद तक है कि भाई इंटरपर्सनल है स्ट्रेस, अगर सराउंडिंग से है, या फर्ज करेंगे उसका एक another child है, so वो भी एक स्ट्रेस है कि भाई how to take care of two kids, right? या ये कि husband is not very supportive, या domestic violence, that's another stressful condition. right? Yeah, agar in-laws hain and they are very demanding, that's another stressful condition. Or there's a financial stressors, right? So all these are the combination of different scenarios which can cause actually postpartum depression, right? Or psychosis. So उसमें ये है कि if we will take one by one, so yeah, अगर जैसे पहले भी I mentioned कि अगर आपके और बच्चे हैं तो you can manage how you can manage with, maybe you arrange with some other moms, pick and drop and things like that, right? अगर तो husband interpersonal issues हैं husband के साथ और violence है, domestic violence है, तो you may want to have a more professional help. And in this day and age where we live, there are so much social services, right? So it's important to involve them, especially if it's a domestic violence, because it's not only towards the mom, then it will progress to the children as well, right? So so that's therapy के लिए, mental health therapy के लिए आप जा सकते हैं to resolve the issue. And उसमें again फिर से आई interpersonal therapy या different therapies which जो कि और supportive therapy पे जा सकते हैं. So these are the things which can help. Financial issues, I think everybody have their own set of, maybe have a, look around what you can afford, which you cannot afford, right? Things like that. So it will put less pressure on the family overall, which in itself decrease the stress, and then outcome will be better. So there are different avenues, which is, the stressful situation was caused by, and अगर आप उसको overall सोच के रखें or so the prevention will ultimately prevent the outcome overall. But yeah, definitely take the professional help if needed, rather than it come down to that later on ACS will be calling because of the abuse and this and that happened. Get the professional intervene early, so that it will help the family overall. Okay, yeah.
Thank you, Dr. Tasbi.
Yeah.
And last, I want to ask you that if you want to give us some take-home message, then we'll wrap up our program.
So I would like to say something. As a parent, our words are powerful. After all that childhood depression speech, or it was more interactive, but I would say at the end that our words are very powerful. So use your words very like gently and with so much care, because I have one example. Like if you hurt your child by saying the child you're a stupid or you cannot do anything, or more bad, if you say one bad word to your child, you have to fill that bucket with 9 positive things. So imagine that the impact of one like kind of hurtful thing to your child. If you want child to overcome with that, you have to give that child 9 positive things with that. So imagine we so if the child get more deficit of positive things, that child's gonna get depressed. And I'm saying that parents words are so powerful because you are the ones who the child trusts the most. So and their mental health and their well-being starts from you. So just remember that your words are so powerful. So always use a positive, encouraging, and words that are full of love with your child.
Excellent, Dr. Mehreen. Now, Dr. Tasbi, if you want to say something.
So I always like one saying, and it is prevention is better than cure. So it's better if we can detect, try to be proactive in our lives and in our spouse's life or wife or husband life, and figure out early that what's really not helping or if there's a warning signs, early signs of depression, or there's a stressful situation going on in the home which is not being addressed. These are the things which needs to be addressed early on. If we start being proactive and address the issues early on, the outcome would be better. So basically, there are always a solution. Even the things get worse, it can get better, but it's better if we will pick it up a little earlier. So that's pretty much, I would say. Yeah.
Thank you so much, Dr. Tasfi. In the end, I would like to extend my gratitude to our respected speakers for their valuable time and sharing their knowledge with us. We really learned a lot from today's discussion. Jazakallah. Over to you, Varda. Thank you.
Thank you so much, Dr. Nazneen. And it was such an informative session for, I think, everybody. And it's very important to address not just the children, but of course, the children and their parents and the spouses together and the families all together, and of course, the friends, because together a healthy community will in the end build healthy individuals. So thank you very much, Dr. Tasbih Fatma. Thank you very much, Dr. Mehreen Raza, and thank you very much, Dr. Nazneen Zaidi. I would also like to thank the media team, Sir Asher Zaidi, and I would also like to thank Dr. Huma Naqvi for all her guidance. And inshallah, see you everyone next month soon again. Till then, take care of yourself. Allah Hafiz.
Okay. Thank you for having us. Thank you.
Thank you.
Bye.
Bye-bye.